When an intelligent person throws themselves on the floor, begging a partner not to leave, or a successful executive freezes with panic before a routine presentation, they experience a system failure. These moments represent automated outputs generated by a corrupted internal information processing system. Clinical psychologist Dr. Francine Shapiro developed a framework to trace these errors. Through her work with EMDR therapy, she established a method to reverse engineer these reactions and isolate their neurobiological source code. Her adaptive information processing, or AIP, model relies on the principle that the mind and body are intrinsically linked. When an experience overwhelms the nervous system, the memory is stored as raw, unprocessed data. Identifying the origin of that data requires locating the touchstone memory. This is the specific neural network that generates maladaptive responses to harmless current events. The path to resolution involves recognizing present-day weather, mapping the underlying climate, and applying somatic patches to stabilize the system. If psychological suffering originates as a mechanical error in data storage, then it becomes a problem solvable through systematic deconstruction. Daily emotional symptoms are the weather. They are driven by the climate, the massive underlying networks of unprocessed memories. Interventions focusing solely on the weather provide temporary relief, but the underlying climate remains, leaving the individual prone to relapse. We can see this in clinical evidence comparing psychopharmacology and EMDR. A study in the Journal of Clinical Psychiatry found that while antidepressants helped change the brain state, patients began relapsing once the medication stopped. The EMDR group, however, continued to improve. By addressing the memory networks directly, EMDR shifts the foundational climate of the brain. This model relies on the assumption that extreme distress is always rooted in the past, potentially overlooking valid reactions to a currently toxic environment. But in a safe environment, lasting change requires a structural update to the foundational memory network rather than chemical management of daily distress. To find the source of a disturbance, we use the TISIS log. It deconstructs an overreaction into 5 variables: trigger, image, cognition, emotion, and sensation. The floatback technique then uses that somatic and cognitive data to trace a neural path back to the earliest childhood association. Sandra, a corporate trainer, used this to trace her presentation anxiety back to a specific 4th grade classroom humiliation involving her teacher, Mrs. Alpert. Isolating the negative cognition allows the brain to follow the signal back to where that specific belief about the self was first encoded. The Subjective Units of Distress, or SUD, scale provides the quantitative metric for this process, measuring the disturbance from 0 to 10. This mapping requires high levels of self-awareness. For those with complex disorders, these exercises can be destabilizing and should only be performed with a therapist. When used correctly, the TISIS log transforms a mysterious emotional outburst into a traceable clinical map. Negative cognitions are the verbalized symptoms of unintegrated neural data. These beliefs generally fall into 3 categories: responsibility, lack of safety, and lack of control or power. These pillars function as corrupted lenses, tinting perceptions in relationships and leading to chronic feelings of being wounded or unappreciated. The case of Derek, an Iraq war veteran, demonstrates how these pillars function in high-stakes trauma. Derek experienced a severe overreaction to his son's crying, driven by the negative cognition, "I can't handle it." His TISIS log identified that his current panic was a direct symptom of his war experience, mapping the "I can't handle it" cognition back to a combat memory rather than his parenting ability. We should note that focusing strictly on neural reprocessing can ignore the impact of systemic reality. However, in a clinical context, irrational beliefs are simply stored information waiting for an update. Because trauma is stored viscerally, cognitive understanding is insufficient. Somatic interventions are required to downregulate the nervous system. The Lightstream technique manages physical and emotional pain by having the individual identify the shape, size, and color of body sensations. In Indonesia, this technique enabled trauma victims to resolve severe insomnia within 3 days. Bilateral stimulation, like the butterfly hug, provides a mechanical lever to trigger a relaxation response. These techniques can unpredictably trigger highly disturbing material. They require careful regulation to ensure the individual remains in a state of stability. These somatic tools function as safety switches, allowing the brain to maintain the stability necessary for deep data processing. The process moves from identifying the weather symptom to mapping the touchstone network and applying somatic regulation. Our reactions are governed by the mechanical way our brains store and retrieve information. Integration occurs when isolated, distressing data is successfully woven into the brain's healthy, adaptive networks. Updating the brain's information processing system ensures that past events no longer dictate present reality. The objective of the Insight Engine is making the past irrelevant to the automated systems of the present.